So our true challenge is to learn how to live with drugs so they cause the least possible harm and, in some cases, the greatest possible benefit. I'll tell you something else I learned, that the reason some drugs are legal and others not has almost nothing to do with science or health or the relative risks of drugs, and almost everything to do with who uses and who is perceived to use particular drugs. In the late 19th century, when most of the drugs that are now illegal were legal, the principal consumers of opiates in my country and others were middle-aged white women, using them to alleviate aches and pains when few other analgesics were available. And nobody thought about criminalizing it back then because nobody wanted to put grandma behind bars. But when hundreds of thousands of Chinese started showing up in my country, working hard on the railroads and the mines, and then kicking back in the evening, just like they had in the old country with a few puffs on that opium pipe, that's when you saw the first drug prohibition laws in California and Nevada, driven by racist fears of Chinese transforming white women into opium-addicted sex slaves. The first cocaine prohibition laws, similarly prompted by racist fears of black men sniffing that white powder and forgetting their proper place in Southern society. And the first marijuana prohibition laws, all about fears of Mexican migrants in the West and the Southwest. And what was been true in my country is true in so many others as well, with both the origins of these laws and their implementation. Put it this way, and I exaggerate only slightly. If the principal smokers of cocaine were affluent older white men and the principal consumers of Viagra were poor young black men, then smokable cocaine would be easy to get with a prescription from your doctor, and selling Viagra would get you 5 to 10 years behind bars. I used to be a professor teaching about this. Now I'm an activist, a human rights activist. And what drives me is my shame at living in an otherwise great nation that has less than 5% of the world's population, but almost 25% of the world's incarcerated population. It's the people I meet who have lost someone they love to drug-related violence or prison or overdose or AIDS because our drug policies emphasize criminalization over health. It's good people who have lost their jobs, their homes, their freedom, even their children, to the state, not because they hurt anyone, but solely because they chose to use one drug instead of another. So, is legalization the answer? On that, I'm torn. 3 days a week, I think yes. 3 days a week, I think no. And on Sundays, I'm agnostic. But since today's Tuesday, let me just say that legally regulating and taxing most of the drugs that are now criminalized would radically reduce the crime, violence, corruption, and black markets, and the problems of adulterated and unregulated drugs, and improve public safety, and allow taxpayer resources to be devoted to more useful purposes. I mean, look, the markets in marijuana, cocaine, heroin, and methamphetamine are global commodities markets, just like the global markets in alcohol, tobacco, coffee, sugar, and so many other things. Where there is a demand, there will be a supply. Knock out one source and another inevitably emerges. People tend to think of prohibition as the ultimate form of regulation, when in fact it represents the abdication of regulation, with criminals filling the void. Which is why putting criminal laws and police front and center in trying to control a dynamic global commodities market is a recipe for disaster. And what we really need to do is to bring the underground drug markets as much as possible above ground and regulate them as intelligently as we can to minimize both the harms of drugs and the harms of prohibitionist policies. Now, with marijuana, that obviously means legally regulating and taxing it like alcohol. The benefits of doing so are enormous, the risks minimal. Will more people use marijuana? Maybe. But it's not going to be young people, because it's not going to be legalized for them, and quite frankly, they already have the best access to marijuana. right? I think it's going to be older people. It's going to be people in their 40s and 60s and 80s, who find they prefer a little marijuana to that drink in the evening or the sleeping pill, or that it helps with their arthritis or diabetes, or maybe helps spice up a long-term marriage. And that just might be a net public health benefit. As for the other drugs, look at Portugal, where nobody goes to jail for possessing drugs, and the government's made a serious commitment to treating addiction as a health issue. Look at Switzerland, Germany, Netherlands, Denmark, England, where people who've been addicted to heroin for many years and repeatedly tried to quit and failed can get pharmaceutical heroin and helping services in medical clinics. And the results are in. Illegal drug abuse and disease and overdoses and crime and arrests all go down, health and well-being improve, taxpayers benefit, and many drug users even put their addictions behind them. Look at New Zealand, which recently enacted a law allowing certain recreational drugs to be sold legally, provided their safety had been established. Look here in Brazil and some other countries where a remarkable psychoactive substance, ayahuasca, can be legally bought and consumed, provided it's done so within a religious context. Look in Bolivia and Peru, where all sorts of products made from the coca leaf, the source of cocaine, are sold legally over the counter with no apparent harm to people's public health. I mean, don't forget, Coca-Cola had cocaine in it until 1900. And so far as we know, is no more addictive than Coca-Cola is today. Conversely, think about cigarettes. Nothing can both hook you and kill you like cigarettes. When researchers ask heroin addicts, what's the toughest drug to quit? Most say cigarettes. Yet in my country and many others, half of all the people who've ever addicted to cigarettes have quit without anyone being arrested or put in jail or sent to a quote-unquote treatment program by a prosecutor or judge. What did it were higher taxes and time and place restrictions on sale and use and effective anti-smoking campaigns. Now, could we reduce smoking even more by making it totally illegal? Probably. But just imagine the drug war nightmare that would result. But every one of us believe that this war on drugs, this backward, heartless, disastrous war on drugs has got to end.